Today we're going to be talking about hair loss. It's one of the most common problems I see as a skin doctor. So there are a few things you can do at home, and there are a lot of reasons why people can have hair loss. So it's always best to see a dermatologist in person to get an accurate diagnosis and the best treatment. But I do want to tell you some things you could do at home. So first of all, let's say this. A lot of people get worried about hair loss because they're noticing, hairs after, washing their scalp. They notice the hairs in the shower and things like that. So I want to let you know it's normal to have 50 or 100 hairs lost per day. That's totally normal, believe it or not. So hair loss can have a whole lot of different reasons. One of the most common reasons for hair loss is hormonal shifts in the body. And this can happen in men and in women. You see it with, men as they age, and then women a little less commonly. They don't become typically bald like men do. Another thing we see a whole lot is traction alopecia. So that's a type of alopecia if the hair is put into tight braids or tight caps are worn, or tight headbands. Those kind of things can cause pulling that irritates the hair follicle and causes, even at the end, can actually cause scarring and make it impossible to get the hair back. So you always want to do very gentle hair care. If you're doing those type of things, you want to just switch and go to gentle hair care. Now there's a whole myriad of different reasons for hair loss. Some of them deal with our immune system, and then some of them can cause scarring and some cannot. Now if you don't have a scarring type of process going on, you can typically get hair back with a particular over-the-counter product. So if you are getting scarring though, again, your options may be somewhat limited, and you may be trying to control future loss rather than regrow hair. One of the common misconceptions about hair loss is that it's vitamin related. And some vitamins like vitamin D or minerals like iron can be associated with hair loss. However, this is fairly uncommon. We sometimes will check these things to optimize it, but it's not usually a primary reason for hair loss. So one of the most common treatments that we use for a variety of alopecia or hair loss is called minoxidil. So minoxidil is available over the counter without a prescription. It's a 5% solution. It can be labeled for men or women. It's actually safe to use in both. It comes in foams and solutions, and you can apply it to the scalp. You don't want to apply it to the hair. You need it on the scalp, and that's where it works. And it helps to kind of kick our hair into a growth phase. I kind of call it like hair fertilizer, basically. You can get some excess hair shedding when you first start it, but in the long run, you'll have more hair follicles. So this is not a quick process, and hair loss usually isn't a quick process. So when you start it, don't expect any results for about 3 to 6 months, and you'll start seeing the best results at a year. It's a win if we can maintain our hair and prevent loss. It's even a greater win if we're able to actually regrow more hair. So this is very affordable now. You can get it for about $40 for a year's supply, so it's not too bad. The most common reaction that people have is just skin irritation from it. Sometimes switching from the solution to the foam or from the foam to the solution can help alleviate that. But the other thing is sometimes people get a little excess hair growth in areas that they didn't apply it. So those are really the most common side effects. So it's very, very well-tolerated medication, and it can help nearly any type of alopecia. And we usually use it in conjunction with other treatments. But if you have normal pattern baldness like a guy, you can potentially use this and get some extra hair growth back or preserve what you have now. So if this has helped you, please feel free to like and subscribe and ask any comments that you have in the comment section below. Thank you guys so much for watching.